This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Prof, I've just shared your phone number and your email address in the chat in case someone wants to contact you to speak further. I have another question. Could you talk about fertility preservation techniques and how they're evolving for women in their 30s and 40s?
Yeah. Okay, so fertility preservation means taking, well, on the female side, stimulating a cycle like an IVF cycle, producing multiple eggs, and putting them in the freezer for future use. It originally was developed in patients, young patients who had cancer, and their cancer therapy was going to potentially make them menopausal. So before those treatments were undertaken, eggs were collected and frozen. When that first started, the techniques of freezing eggs were pretty poor. The odds of one of those eggs producing a baby was less than 2%. It may not sound great, but when we produce an egg now, and with the newer techniques of freezing, an egg has somewhere between an 8 and a 10% chance of a pregnancy if you're under 35. Now, 8 to 10% doesn't sound much, but compared with less than 2%, it's a huge step forward. Because what you've got to then do is multiply it by the number of eggs that a woman has. So if she gets 10 eggs and each of them has 10% chance of a pregnancy, she's got a massive chance of having a baby. More and more women seeking out fertility preservation because at the age of 30, 32, 33, 34, 35, they don't have Mr. Right. They do want to have a baby, and they are aware that from 35, 38 on, egg quality begins to decline. So when they find Mr. Right at 39, their odds of a pregnancy are something around about 40% less than when they were 30. So freezing your eggs at 30, those eggs remain in limbo, basically, and they will react in the way of a 30-year-old, particularly now that we have freezing techniques that seem to be much, much better. Survival of eggs after freezing and thawing is very much higher, and the formation of embryos is higher, and the pregnancies are good. Pregnancy rates are good. Beyond 38, there's a major problem in terms of the rationale for freezing your eggs. It may seem the right thing to do because, again, as I say, Mr. Right hasn't turned up when you're 40. You don't want to have a baby with donor sperm at that point, so you're going to try and freeze your eggs. Sadly, at 40, the quality of the eggs means the odds of a pregnancy, no matter how many eggs we get, is not going to be great. And the other problem at 40 is the numbers of eggs that you are going to get when we stimulate you is going to be less. So the combination of those two mean it's pretty unlikely that you'll get a pregnancy by freezing eggs at 40. Many women still do because they want that chance, because obviously at 45 it's hugely even less. Freezing eggs even at 40 is still a worthwhile thing to think about, but you have to be realistic about it at that age. Just to give a comparison of the number of eggs, and this is data out of the United States, where it's more common than in Australia. The data out of the United States suggests that if you're 30, to get a 50% chance of a pregnancy with frozen eggs when you froze them at 30 is around 6 or 8 eggs. By the time you're 40, it's 60 eggs to give you that 50% chance of success. Now, very few women are going to go through cycle after cycle, both from a cost perspective and also the process, to collect 60 eggs to give them that 50 chance of a baby. So that's the realistic numbers. So faced with that, which is what I say to the ladies, I will still have ladies saying, no, I still want to put something aside. It gives me some feeling of It's not a guarantee. It's a gamble. But it gives me some hope that if I'm trying to get pregnant at 45, I've got better chance than with my 45-year-old eggs. And that's true. So fertility preservation is on the rise in Australia, and I think it will continue to do so as our social demographic, and that's what's driving the fertility preservation, men and women waiting later and later. One, firstly, to actually form a long-term relationship. And secondly, when they do form that relationship, they still don't want to have babies until they've got the car, the house, the mortgage sorted out. And the financial implications of having a baby become a major decision-making process of putting it off and putting it off. But sadly, nature hasn't kept up with the social demographic change. Women are programmed to have a menopause at 50. They're programmed to have poor egg quality after 40. And nobody's yet changed that process.
Well, thank you so much, Prof. I'll just mention that you still do online consults, is that right?
Yes, yeah, I still do Zoom consults from anywhere in the world. But I'm happy to see patients either in Sydney at Cogra or in Potts Point.
And the contact details I have here for you is 02 9138 4222 phone number.
Yes.
And email address is m.chapman@unsw.edu.au.
Yes, that's fine. Yes. Yeah, happy to receive any, please.
I've posted that in the chat as well, and we will see you in about 3 weeks.
Done.
Thanks, Prof.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.